All right, hello everyone, and this is week 8. We are entering the home stretch. Um, so this week we're talking about personality assessment, which is, I think, a really complex issue, um, and really brings up the question: what is personality? Um, the Big Five theory of personality, which main instruments are based on, looks at what is called ocean as being the five major personality traits. O meaning openness to experience, C meaning conscientiousness in tasks or work, E being extroversion, or obviously the flip side of that is introversion, A being agreeableness, and N being neuroticism or overly negative perspective. But there are a lot of different ways to look at personality. I also see some like the MMPI, which is the Minnesota Multiphasic Personality Inventory. Um, it looks at more pathological variations of behavior. It's a very difficult instrument to give. It's about 5 to 700 questions, depending on the form. There's a adolescent and then a respondent form as well as a self-report. And different. It's not just like on most scales, like a depression scale. If it's high, it means you're depressed. If it's low, it's not. In this, different scales can be high, and they sort of converge to create a completely new perspective. It's sort of like when two scales are high, or one's high and one's low, like mixing red and blue to make purple. They can mix and create different sort of presentations. Um, but there are also these things we talk about, standardized projective instruments. So those are the inkblot, the thematic apperception test, which generally involves showing a client a picture and having them asking them to create a story based on that. There's also the RAT, the Roberts apperception test, which is more for children. Um, and so what we want to be aware of is, one, a lot in some states only psychologists can give these, or people with doctorates. And two is it's not, I say standardized projective because they don't just look at the inkblot and say, oh, he's insane. He answered this way. There's the Exner system of interpreting, which really looks at some statistical preponderance of the data and looks at different things they respond to, whether it was color, whether it was form, what quadrant of the inkblot they responded to. So it's not quite as hokey as it sounds. However, obviously there's still some art to it. The other thing is, those are standardized, so there is a very specific way they're given. Counselors, however, sometimes use non-standardized projective instruments, which are things like if you had a client draw a picture. In a way, that's an assessment method, and it could be projective. But there's not a set way to explore what that means. So one thing I frequently do with clients is have them draw a picture, after doing a guided image, or have them draw a picture of themselves as a rose bush. It's a very Jungian sort of technique, and what it does is it gives me some ideas about their self-concept. And I always explore those with the client. That's something you should be doing throughout the assessment process, is seeing how this fits with their perception of themselves. So obviously, personality assessment, very interesting topic. So I gave you some things to chew on, and be sure to ask me any questions that might be lingering in the discussion boards.